So just to kind of introduce it, that we're here to discuss the Revitalise Retreat and our work together to provide a really beautiful experience for burnout, people recovering from burnout.
So Ella, is it okay if I ask you some questions that I've got about how you work, which I hope will be useful to people? So I've written a few down. One of them is about the symptoms. If you were working with a client, what are the kind of symptoms that would alert you to the fact that there might be burnout showing up, or exhaustion or overwhelm?
So do you mean as a practitioner, what do I look for, or how would people know that they have burnout?
Well, I suppose my question was, you as a practitioner, what would you look for?
Sure. So as a practitioner, I run bioassays, so tests with people. So I do hair testing. We look at adrenal ratios with the hair testing. I also, do saliva tests and things. But just from kind of behavior and kind of red flags, really, that would alert me to do those tests would be somebody getting out of bed and just dragging themselves around until the evening when they get more energy and then just can't get to sleep. And they have, maybe insomnia or sleep disturbances, but then in the day they're exhausted. Poor immune system, so infections and recurring infections, or catching kind of, bug after bug after bug. What else? So just maybe dysregulation, so feeling kind of very reactive, emotionally reactive. And I work a lot with the nervous system. So we work, we really look at how we're viewing our world and how we're viewing our experience, or how we experience our world. And the more burnt out we are, the less adrenal energy we have, really, because we've kind of hit this high and then crashed. Everything becomes too much and we become overwhelmed and suddenly can't cope. So I look for those, the language of the client, the language of the person in front of me who's maybe might say, it's too much, it's overwhelming, kind of the idea that the world is big and that they're small, and it's too much to deal with.
So where would you start with them, with your clients?
Yeah, so before doing any nutrition work, any changes, anything else to do, my aim is to really help the person get into a space of where they're coming from and who they are being and how the world feels to them. And so, you can do the two of the same exercises. So you can go and cook yourself a really healthy meal, but in a really frantic way, and not present. Or you can go and make yourself kind of something super, super simple, but be very present with it. And for me, it's that presence. It's about getting the person into that state of presence. So I do pranayama, I do, EFT, so emotional freedom technique. I do
pranayama. Just tell me what
pranayama is breath work. And energy practices. And I use different modalities to be able to bring the person back to their center. And I also do polyvagal coaching. So really helping to creating a space where the person can really get present too. So now, as we're talking, your nervous system will be responding to me. And that's what I'm really present to, is that sense of co-regulation. So that's really where I start. And the person who's in front of me will start to get a real sense of their own ability to regulate once they've experienced what it feels like to be safe in their body, to feel grounded and regulated. And it takes practice. And that's why, we want to do it over time. So over kind of a week, or if we've only got a small amount of kind of slots, and we'll do it over a long extended time. But it's really practice, and it's a really lovely way to get to a sense of groundedness and regulation before you start any nutrition work. Yeah.
So it sounds like you're creating awareness as first a starting point.
Yeah. Awareness and self-connection.
Which can often be severed if you're burnt out.
Absolutely. So my experience is one of the first steps on the path to burnout is ignoring yourself, ignoring your own instincts, ignoring your own, or it may not be, it may be intentional, maybe sabotage, it may be kind of a form of self-punishment, whatever those drivers are. But yeah, it's an absolute self-abandonment and a kind of refusal to listen to your own, internal alarm system that says, hang on, you need to rest or you need to stop. And
in my experience, that's often a very old pattern for people, because they've had to attend to other people or survive in a different way, learn different strategies.
Yeah, absolutely. Or there is a sense of kind of proving themselves or looking outside for that sense of approval or acknowledgement, and often, and Gabor Mate says as well that chronic health issues, autoimmune issues, burnout comes from perpetual people pleasing, a need for other people's acknowledgement. And it's actually, as well, the carers that are burning out, like you say, the nurses and the doctors and the teachers and the healthcare practitioners and providers. Yeah. Yes,
absolutely. It's systemic, isn't it, now?
Yeah, absolutely.
So if I was your client and I'd started on this self-awareness exercises and set up a practice either with you or on my own, what might I start to notice?
Well, I invite you to do it now, and anyone who's listening to do this now, just as you're listening and as you're being in the space with me, just noticing your breath and noticing how your body feels. And I walk people, one of the first things that I do with people is walk them through the map of the polyvagal, the nervous system through the lens of the polyvagal theory. So the ventral state, which is the safety and connection, how we feel when we feel connected. How does that feel in our body? And at this point, most people that I work with, so you remember the people who come to me have had a chronic health breakdown. At this point, mostly when I invite people to connect to their sense of safety, that brings up emotion, because people say that's so unfamiliar. That's such an unfamiliar place for me, and it makes people feel really sad, actually. And it's kind of like, there's a word in Welsh and it's called hiraeth, which means a longing, like a homecoming or a longing for home. And that's a real, what this is I see this work as really bringing people home back to themselves.
So you've described a bit how you would work with a client normally, probably. How would you work on this week in Italy? What's it going to look like from your aspect of it?
It looks like setting up a really boundaried space, a really solid space for people to feel really safe inside. It looks like holding classes on the nervous system and the polyvagal theory. So exactly what we were just talking about. So doing the sessions and the awareness sessions with people, so that they can start feeling their ventral state and feeling that sense of self-connection. And it really, as well, curating really lovely menu for people supporting their adrenals. And that's, in Italy as well, it's just going to be such a joy to eat that delicious food and really just creating kind of, and I know that we've talked about this of the not packing it really full, just kind of really mindfully choosing exactly what we feel would be of the most benefit for people. And that's a real kind of balance between space and coming together and doing classes and sessions, and and then also I'll be offering kinesiology, so muscle testing, so people can really get to understand their own body, what works for them, what doesn't work for them food wise, and lifestyle and the way that they're living, and just the idea that when they go home they feel really resourced, they feel energized, they feel kind of full up, and they feel more than anything just really connected to themselves and what serves them, and to go home with feeling really calm and grounded, but also ready for a new life.
And also you talked about this kind of upside down day that people often live, which is feeling exhausted in the day and then kind of feeling wired at night and not sleeping. And I know when we planned the week, we talked about trying to get the energizing activities earlier in the day, and some very calming, stilling exercises later on in the day, so that we reset the balance of the day.
Yeah.
That sort of circadian rhythm and the adrenals resetting themselves to support us.
Yeah, absolutely. And just to giving that kind of lovely space in between as well. A lot of people have that blood sugar crash or feel exhausted in the middle of the day, especially with burnout, the body needs a lot of rest. So we've put in a lot of spaces for that rest and for that kind of self-reflection. And
yeah, thank you so much for telling me about your side of it. That's really exciting.
Yeah, thank you. Thanks for asking.